Hello and welcome to the presentation of Caring Science, applying the Caritas process to the nursing practice. This is based on Watson's Caring Science, which is a grand nursing theory. It's a framework upon which you can interpret nursing practice, and its perspective is that the patient is more than a physical entity, but rather a spiritual being with a consciousness, mind, spirit, and metaphysical energy. In order to effectively treat the patient, then the nurse must recognize the complexity of this multidimensional reality and connect with the patient on an existential level. What this really boils down to is sort of a separation from traditional Western medicine that sees the patient in terms of more of a physical anatomy and physiology, disease process, cellular biology, and medication that's used to treat these conditions. This is sort of considering the patient in all of their various complexities in terms of their spirituality, in terms of their consciousness, in terms of a culture, relationships, family dynamics. So it's trying to address all of these different components of a person. And so her attempt then is to sort of separate out the strata of who a person is in addition to just their physical being. And that's the purpose. What she's doing is, in this theory too, is trying to define the profession of nursing by giving it its own unique language and terminology. She believes that to truly be a profession and to differentiate yourself from sort of underneath the shadow of medicine, traditional medicine again, you need to have your own terminology, your own language, your own um, ways of expressing these ideas. She seeks to legitimize human experiences and the human caring healing in contrast to conventional science, as we mentioned. So again, it's trying to address more layers of a person than just, gallbladder, large intestines, heart, etc. It's trying to see the spiritual things. It ties into Florence Nightingale's notion as well, and she mentions Nightingale in her writing of that the body will tend to heal itself when the environment is sort of optimized to do so. And part of nursing's job is to make sure that the body has a chance to heal itself and that these processes that sort of recover health are restored by addressing other aspects of a person so they can heal. It differentiates nursing from traditional medicine, but at the same time embraces a union between humanities and science. And you see this a lot. There's a juxtaposition in a lot of her writing that she is trying to separate herself and nursing from traditional medicine, but at the same time also wants to incorporate all studies like sociology, psychology, science, biology, everything, and sort of have an interdisciplinary study. She sees it as the foundation for nursing as a profession and encourages nurses to be fully present and engaged in the moment. She feels that this is sort of a key to how this works and having a successful interaction between the patient and the nurses to be very aware of the moment that you're in. She's trying to reintroduce spirit and sacred dimensions and having a reunion between metaphysics and material physical world. Again, going back to the themes that you'll see throughout of you have two separate studies or disciplines, but they can complement one another and they can actually work together and each informs the other. She breaks it down into the Caritas processes, and there are 10 of these factors, curative factors. Um, Basically, the way that she describes them and she looks at them as these are building blocks for practical application of the theory to nursing practice. This is the roadmap. This is the guide to take a more esoteric, a more abstract theme and theory and put it into real practical use. And these are the guidelines. She also says it's important to know that all of these factors, there's 10 of them, all of them are present at once, each informing the other, whether one is in the foreground and one is in the background. You're not just doing one of the processes and neglecting the others and then moving on to another one. They're all sort of working at the same time and they complement one another. And whether we're aware of them or not, they're all sort of functioning at the same time. Another very essential component of this theory and the Caritas in specific is caring and love. She says caring and love are intricately connected and the foundation of her theory. The coalescing or coming together of these two constructs allows for the full expression of transpersonal caring. Love is regarded as the greatest source of healing. So, in her theory, love basically is one of the most important elements to have here. And when you combine it with caring, it's basically to the point where she feels that it can save humanity. She puts it in those terms that combining caring and love is a cornerstone of nursing and of human dignity and human consciousness, and is actually necessary to sort of preserve humanity. So she gives it that much importance. The particular Caritas that I chose, which appeals to me personally, is number 6, which states creatively problem solving, solution seeking through caring processes, full use of self and artistry of caring, healing practices via use of all ways of knowing, being, doing, and becoming. I always look at this one as sort of the engineer's Caritas, which I believe if I wasn't a nurse, I would have been an engineer because I love to problem solve and I love to find solutions for things that need to be built. I love building things and kind of coming up with these inventions and solutions. So this one encourages creative problem solving. It emphasizes the application of knowledge, but it also warns against what she calls linear nursing and the restrictions of only following evidence-based practice without relying on other forms of knowing. She addresses this issue in some detail, basically stating that it's sort of an error to think that we only should go based on what evidence shows us to do, and that we should rely on experience and trial and error and things that we've learned just from our years of nursing. And maybe sometimes we can't formalize and exactly say why we know something should be done, but that does not take away from any of its validity. It's hard earned and it's something that we know as a result of experience. So it's basically encouraging us to draw from all experience to make nursing decisions and not sort of get handcuffed or get tunnel vision with just evidence-based practice. As she states, it integrates and is informed by the best sources of evidence, sources plural, within a horizon of knowledge that embraces theory, ethics, values, and the best personal, professional, empirical, technical, clinical judgment and decision making available. Again, it's encouraging us to draw from all facets and all aspects of our knowledge and experience and what we've seen, what we know works, what we know doesn't work by sometimes by very hard lessons and by making mistakes, but we know not to do it the next time. So I like this one personally for me just because I believe in that. I think that that's absolutely true. And there's some clinical examples I have from my own practice. A couple of them I'll mention here. So one would be what I call medications from Mexico. A patient came in for a simple vaccination, um, but a lot of times in these cases they do mention other symptoms that they're having, and it turns into sort of like a mini consult. But this particular patient was saying that they were weak and lightheaded, and I remember when they came in, they had a bag of pills with them, and one of the bottles sort of stood out. It was different color and had an odd label on it. So somewhere in my mind, I was thinking about that. I decided to take the patient's blood pressure and actually found them to be a little bit hypotensive um, to go along with their weakness and lightheadedness. I then asked them if I could look at the medication and found that it was a prescription bottle from Mexico. And the patient had actually gone to a doctor in Mexico, and the doctor, not knowing that the patient was already on blood pressure medication, had started them on this particular one. And then, of course, the doctor in our clinic didn't know that they had gone to Mexico and were now on a double dose of blood pressure medication. So we were able to stop that medication, and then the patient came back in to recheck the blood pressure and was found to be within normal limits at that point. So I think that's a good example of sort of using our clinical experience, and there's not going to be an evidence-based practice study that's going to show that you should, do any of these particular steps, but it's just sort of a gut feeling, and it's from experience and our noticing certain things that can draw our attention to that. Another example was what I call the Foley catheter debacle. It's a patient that came in, they had a Foley catheter in place and it was irritating them, so they decided to remove it themselves. And they did this by cutting the actual tubing on the outside between the urethra and the bag. And the part of the tubing retracted back into the urethra. Well, the solution to this was going to be a surgery. They were going to have the abdominal wall opened up and then the bladder wall opened up, the balloon deflated and pulled out. And actually, they had already consulted with the surgeon, and he was on his way in to discuss it with the patient. And I just started thinking there has to be a way that we can resolve this without surgery. It seems so extreme. So I remember that we have very long lumbar puncture needles. So I found the longest one that we had, and with working with the doctors and getting their permission, we made a plastic sheath around the needle and then just left the end um, available with the actual needle poking out the top. And then we threaded it through the actual remainder of the Foley catheter that was in the urethra, and we're able to introduce it into the bladder and puncture the balloon and then pull it out. So basically, we saved the patient from having invasive surgery um, by using something that is not traditionally used for such a purpose. But again, it's sort of in the spirit of the Caritas number 6 of using all means of knowledge and experience and creativity to solve a problem, and ultimately for the improvement of patient outcome. There is indeed very hardy evidence for success of Watson's theory in practical applications. Various studies have demonstrated that her theory has applications that go towards nursing practice on a day-to-day basis. Significant increase in patient satisfaction when curative factors are implemented by nursing staff. This was shown in a 2017 study. Implementing theory of caring for a patient unable to conceive allowed the patient to regain hope. Um, and this was a case study that they did in 2015. It's also been shown as an effective framework for enabling spirituality for end-of-life care in oncology patients in 2018. And these are just a handful of probably hundreds of studies that have been done showing the efficacy of the theory, so that shows that it has actual broad nursing applications in real world examples. So I thank you for your time and listening. I look forward to having discussion about the presentation and looking forward to looking at everyone else's presentations as well. Thank you very much for your time. Have a great day.